How to avoid preterm birth. The best treatment options. Preterm birth, also known as premature birth, is the birth of a baby at less than 37 weeks gestational age. These babies are known as preemies or preemies. Symptoms of preterm labor include uterine contractions which occur more often than every 10 minutes, or the leaking of fluid from the vagina. Premature infants are at greater risk for cerebral palsy, delays in development, hearing problems, and problems seeing. These risks are greater the earlier a baby is born. The cause of preterm birth is often not known. Risk factors include diabetes, high blood pressure, being pregnant with more than one baby, being either obese or underweight, a number of vaginal infections, tobacco smoking, and psychological stress, among others. It is recommended that labor not be medically induced before 39 weeks unless required for other medical reasons. The same recommendation applies to cesarean section. 3. Medical reasons for early delivery include preeclampsia. In those at risk, the hormone progesterone, if taken during pregnancy, may prevent preterm birth. Evidence does not support the usefulness of bed rest. 6-7, it is estimated that at least 75% of preterm infants would survive with appropriate treatment. In women who might deliver between 24 and 34 weeks, corticosteroids improve outcomes. A number of medications including nifedipine may delay delivery so that a mother can be moved to where more medical care is available. And the corticosteroids have a greater chance to work. Once the baby is born, care includes keeping the baby warm through skin-to-skin contact, supporting breastfeeding, treating infections, and supporting breathing. Preterm labor is a serious condition. Make sure that you get knowledge of this issue and prevent it for good. In this writing, I am going to show you the most effective ways on how to prevent preterm labor naturally at home. Read and prepare for your healthy pregnancy and safe birth giving. Prematurity, or preterm labor, can adversely affect the health and future of the baby, so pregnant women should be careful with their daily activities as well as maintain a healthy nutritional plan during pregnancy to partly limit or completely avoid this situation. Normally, during pregnancy, pregnant women should do gentle activities to maintain the muscle strength and power. The pregnant women who have exercise routine before pregnancy still should maintain this habit while they are pregnant, with duration and intensity adjusted depending on their own health situation. But they should avoid doing heavy activities and the practices which need to be focused too much. Future mothers who normally do not have exercise routines should go out for a walk near the house in the evening after dinner. Note, when pregnant women do exercise or activities, they should definitely and completely avoid compressing the abdomen, while the duration should be also properly controlled for not too long. Sometime, excessive exercising can also lead to preterm labor. The late period of pregnancy will lead to increased excretion. Therefore, if pregnant women do not pay attention to hygiene, they can have increased risks of urinary tract infections. The severe infections may cause early fetal membranes rupture, resulting in preterm labor. Therefore, pregnant women should choose 100% cotton panties. If the amount of excretion is too much, you can use tampons, but you should often change the tampons regularly and avoid washing your vagina too many times to avoid washing out the mucus which protects the vagina. You will just need to consume a tablet or capsule of daily multivitamin to not only improve your overall health when you are pregnant but also reduce the overall rate of preterm birth. Multivitamins are especially essential for pregnant moms who cannot consume rich meals. The supply of nutrients through the daily diet is very important for Pregnant women. So the experts recommend that pregnant mothers should eat 5 meals a day regularly, 3 meals and 2 snacks, instead of 3 meals as normal. Eating many small meals every day will help to reduce the morning sickness and also reduce the risk of preterm labor. When pregnant women are urged to urinate, they should not hesitate, because if this would lead them to be very susceptible to cystitis. When the bladder is inflamed, it will stimulate and cause the uterine contractions. In addition, fasting urine can also increase the risk of urinary tract infections, a cause of uterine contractions which leads to preterm labor. Women with bacterial vaginitis have a very high risk of preterm labor. Therefore, if you get this condition, you will need to tell the obstetricians to prescribe antibiotics to reduce the risk of preterm labor. In case you have had a miscarriage or premature labor, you need to talk to your doctor to get the best care. Foods that women consume can affect their babies. Among supplements for pregnant women, calcium is specially recommended using to prevent preterm labor. Besides, women can eat foods that are high in calcium. The daily intakes of 750 mg of magnesium and 1,500 mg of calcium are good for this purpose. Additionally, during your pregnancy, certain bacteria in the vagina can increase chances of preterm labor, so supply your body with probiotics, vitamin C to boost your immunity and activate good bacteria in your body. Re-examine your diet and make sure that you are going to follow a suitable nutrition diet plan for pregnant women. Keep away from foods that cause inflammation such as processed meats, polyunsaturated cooking oils, such as soy, corn, sunflower, safflower oil, and refined sugars. Also, add foods that are good for your pregnancy such as fish, fruits, vegetables, vitamins, minerals to your diet. Evidence suggests that by practicing good oral hygiene like flossing and brushing, women can reduce the risk of gum disease, a factor leading to premature labor and low birth weight in babies. Beware of the importance of good oral hygiene. Take care of your teeth brushing daily. Even though you can get a little pain when flossing, but it is imperative for you to practice daily for a healthy pregnancy. Yes. As a rule, do not forget to get the flu shot as this can lower the risk of preterm labor. In fact, the flu is the most horrible illness in pregnant women. When the virus works and causes fever, the process of baby growth is highly affected. This situation can cause preterm labor and other serious problems for babies such as birth defects. As a part of pregnancy health care, vaccination must be practiced. And as a good expectant mother, remember to get the flu shot at the right time. As a common rule on how to prevent preterm labor, remember to meet your doctor during your pregnancy. Beside vaccination, pregnant women need to get good prenatal care. Meet your doctor regularly to check out your pregnancy health. Take prenatal vitamins and supplements every day. Practice good prenatal care throughout your full-term pregnancy to prevent unwanted problems for the baby and maintain your healthy pregnancy. By checking out your pregnancy health regularly, you can actively spot some birth defects in your baby and have right solution to fix serious issues. For pregnant women, they can drink about 8 to 10 glasses of water a day, even more during their pregnancy. Just make sure that you can be well hydrated all time. In another way, you can count your weight to drink a proper amount of water in ounces. For instance, if you weighed about 180 pounds, drink about a half of your weight, 90 ounces of water, or 11 glasses of water per day. Especially, you should supply your body with a full of glass of water in the morning. Because, after a long night, your body needs to be supplied with water to detox the body and help other body organs work well. For normal people, it's important to have a breakfast daily. For pregnant women, this meal is essential for preventing preterm labor. Do not skip your breakfast. In addition, add more nutrients to your breakfast such as bacon, eggs, milk, meat and vitamins. Having breakfast also guarantees that your baby will grow healthy, have normal cognitive development, and reduce the risk of low birth weight and birth defects. Among simple yet effective ways on how to prevent preterm labor, you should take some rest and relaxation. Try to get rid of stress, anxiety and depression, as they are psychological factors that affect your baby growth. If a pregnant woman has to stay in a long anxious situation, her health will decrease, her spirit will fall down and as a result, her baby may have to face with some problems such as low birth weight. So, try to have a healthy pregnancy by balancing your life with work and rest, with diet and exercise, with physical health and mental health. According to experts, practice the polar bear position 15 minutes for 4 times every day can help pregnant women take pressure off their cervix. With this position, the baby will move closer to the mother lungs and away from their cervix. As a result, the baby will grow in a more comfortable position for preventing preterm labor. Moreover, the polar bear position will also help the mother easily give birth. Look at the picture of the polar bear position below and try doing it every day. This will work for you and be weird ways on how to prevent preterm labor. Beside the polar bear position as an effective exercise to prevent preterm labor, women can consider the benefits of taking baths during the pregnancy regularly. Scientifically, this is a good way to let the uterus calm down when it begins to be active. This is really useful when you feel an increase in the intensity or frequency of the surges. When this occurs, normally in the evening, it draws yourself a relaxing warm bath. Do it often to settle things down. However, remember to adjust the water temperature that fit the body temperature about 36 degrees Celsius. This is too clear for pregnancy women to get rid of alcohol and cigarettes, as they are harmful triggers for your healthy pregnancy. Much scientific evidence suggests that preterm labor can be increased because of alcohol and cigarettes. They are addictive ingredients harming pregnant women's health and harming their baby's brain and their normal growth. Some serious problems may happen, including birth defects and low birth weight. However, according to scientists, red wine is good for pregnant women and it can aid in preventing preterm labor. In fact, red wine contains healthy nutrients and antioxidants for overall health. Accordingly, the baby will get benefits of red wine via his or her mother indirectly. It's recommended for pregnant women drinking a glass of red wine a day for the preterm labor prevention. Practicing visualization is one of other effective tips on how to prevent preterm labor. The mind and body are often intimately connected. By creating physical changes in your body, you can shift your feelings and thoughts in your mind. Normally, when pregnant women are diagnosed with the preterm labor, they seem to accept the fact that their babies are going to come early. This is just a possibility. Practice visualization to think that it is also possible for you to change the predication that you are going to carry the baby to term. Just concentrate on your positive thoughts and outcome. Put your mind in a deep imagination. In a normal labor, you visualize that your internal muscles of uterus swirling out of its way. In case of a preterm labor, you may imagine the opposite occurring. Keep these muscles tight. Visualize securing and holding the baby in place. Imagine your beautiful blue ribbons, but not the soft and loose ones. As a part of your diet, consider maintaining your health weight for your baby and yourself. If you're obese during your pregnancy, you may get some health conditions that are not good for your baby, such as high blood pressure, diabetes, depression, fatigue, heart disease, and a lot more. As a result, your baby growth will be affected. Among the risk of baby problems, preterm labor is considered a serious problem. So, meet your doctor and check out your weight regularly. The experts will help you control your weight and instruct you to follow a proper diet plan for a healthy pregnancy. Next to effective ways on how to prevent preterm labor, pay attention to homeopathic remedies. They are said to be useful in the preterm labor prevention. Actually, homeopathic remedies are safe, natural, so users will get rid of their side effects. For pregnant women, natural remedies are more important and helpful. For instance, you can drink herbs to improve your sleep quality. You can apply essential oil to improve your mood. Besides, some spices are very useful to fighting off the flu and colds in pregnant women, such as garlic and ginger. Also, you can ask a homeopathic or naturopathic doctor to make sure about the good effects of homeopathic remedies for your preterm labor prevention. Simply get clear that oxytocin and prostaglandin are hormones that are responsible for labor. In reality, doctors recommend pregnant women limiting these hormones release. You can practice it by using condoms while having sex, because semen includes prostaglandins. They are chemicals softening women's cervix and leading to the contraction. Also, avoid stimulating nipple or breast and have multi-orgasms, because all can release oxytocin. Like prostaglandin, this hormone can initiate contractions. Similar to visualization practice and meditation, by calming down your worry and the loss of control, you will get rid of the belief that your baby is coming early. Make a self-talk that your uterus is quiet and calm. Imagine that your baby is growing healthy and maturing fully in your womb. Try to stay in the comfort zone, maintain your overall health to prevent any problems associated with your pregnancy, not only the preterm labor. These are top 15 effective ways on how to prevent preterm labor naturally at home revealed. Hope that you can make use of all these tips to have a health pregnancy.